So a lot of people think it's a lot higher. So give me your hand, Renee.
Yeah.
So if you internally, externally rotate, do you feel that bone that's going over? That's the greater trochanter, right? So that's where your axis is going to be.
So if during, like, let's just say during our practical, if she says find it, like if we start moving them like that and feel right here, eventually we're gonna feel where it's.
You're gonna feel, it's where it's going. But I don't know if she's gonna say find it. She's gonna say, well, do hip range of motion for me. And then most people are just gonna say, well, the hip joints around. See, a lot of people think it's a lot higher, so they're gonna say hip joints are right here, and Barbie's gonna be like, no, that's wrong, right? So if you show her, well, this is how I find the greater trochanter, and that's the axis, she's gonna be like, okay, they know what they're talking about, as opposed to someone who says, to physically find the greater trochanter without touching someone is very, very, very difficult. If the person is not 90 pounds where you can physically see it, you're not going to be able to point it out, right?
Yeah.
You can't find it on me. It's just, and I think I'm skinny, but you can't find it on me, and I'm 170 pounds, right? So to find it on someone, you physically have to touch them and say, okay, well, this is where I find it. That's uncomfortable. That's where your greater trochanter is, right? So then you say, you put it on there. So put it on there.
This is where the axis is going.
Right. So
greater trochanter?
Yes.
Okay.
So if she's starting down here, right, you have to start down here, right?
Yeah.
So it's going to be parallel to the table. When she goes into flexion, go into flexion. You want to keep the stationary arm parallel to the table, right? And then your moving arm is going to line up where?
Right here with your finger.
Right, so you're going to bisect her femur, or you're going to line it up with the femoral condyle, right? So it's going to line up with the femoral condyle. So what is the reading on that?
We started, so it's about 70?
About 70, yeah. That's, well, no, that's what we're testing with your hamstring flexibility. Now, relax for me. When you go up this next time, you can bend your knee. Now do it this time.
Okay.
No. Come back down so she can line it up.
It's right here. Okay. So we move flexion. So it's going to be right even like that?
A little bit higher. And you want to make sure that this is always parallel to the table, right?
Okay.
So there. Now read that.
Okay. So 100?
Right, so she has a little bit more, right? Because we took that hamstring off stretch. Now we know joint range of motion minus soft tissue from the hamstring, right?
Okay. Because will we be able to flex? Or like, will we be able to bend our knee?
Ask Barbie.
Oh, okay.
Say, well, Barbie, do you want active range of motion? Do you want passive range of motion? Do you want range of motion due to tight hamstrings? What do you, just ask her.
Okay.
And then she'll tell you, well, I want full range of motion of the joint without the hamstring limitation.
Oh, okay.
So then how would you measure that?
That would just be like straight what she did earlier.
Minus the hamstring.
No, without.
Oh,
would be bent.
okay,
Right.
yeah, so she'll,
Right.
okay.
Perfect. So then extension would be the same thing, but you would be on your stomach. Right.
And then she'll be going, okay.
Yeah, she'll be going up. So you find the greater trochanter
So
again.
it's like, and this is how the stationary arm is parallel.
Parallel.
So you can bring your leg up, please.
I want to make sure the hips are still on. You don't want to go with that.
Right.
And then it would just be like that.
Right.
Or that.
So what is the reading of extension?
About 32. Oh, 28.
Right. So, perfect.
Okay.
So you caught it.
Yeah,
You
it's like
you want to know which side you read it on. Okay.
Yeah.
Perfect.
Okay.
So then what else? What other range of motion do you have at the hip? Abduction, adduction.
So then it'd just be the same, like you're still placing
Well,
it over.
if she's, okay, so if her motion is going to be going this way and this way, can you place the goniometer on the side?
Oh, no, because then she's going to be pushing
Right.
outwards.
So then where would you place it?
Maybe right over here.
Perfect.
Okay. So, and that's also still over the greater trochanter?
It's not over the greater trochanter. So what's the axis of rotation? for hip abduction, adduction.
Where to place the stationary arm?
No, the axis.
Oh, the axis.
Right. So it's over the anterior superior iliac spine. Right?
Oh, that's right.
So. Where is your ASIS on this guy?
No, it's
Right here.
anterior, superior, inferior spine.
So this is your ASIS, right?
Mm-hmm.
And on somebody, feel this right here?
Mm-hmm.
That's it.
Oh, okay.
If you go superior or inferior, you're not going to find anything else. It's just soft tissue, right?
Mm-hmm.
So find the spine of the ilium, right?
Mm-hmm.
So that's going to be your axis. Your stationary arm is going to be where?
Your femur.
Stationary
Or
arm?
no, the stationary arm is your I don't know what that's. Just your lower trunk, or
Well, if you line it up with her other ASIS, right?
Yeah.
That's going to be parallel, right?
so
So
so it's
she's-
just the other ASI.
Right. So
Oh, okay.
she's starting here, right? Remember how we said we can start at a 90-degree angle? This is starting at a 90-degree angle. But you're not reading the 90, you're reading the
0.
0, right?
Mhm.
So then the moving arm is going to be where? Lined up with what?
Her femur.
Yeah.
So it's going to bisect her femur, or if you say, right? So if I bisect her femur, right? What is it pointing to? What's a
Patella.
physical landmark? Is the patella, right?
Yeah.
So bisect the femur, or point towards the patella, right? So go for it.
Okay. So we're gonna do
So
abduction.
physically line up the ASIS, right?
Yeah. So it's like
So that's one. Where's your second one?
right over here.
Okay, there. And then you want to make sure that it's starting right. Okay.
Mhm.
So then have her go to a range of
Adduction.
motion.
Okay. You're gonna do
AD or AD?
abduction.
AD?
Mm-hmm.
No.
Away
that's
from the
Ab.
body.
Sorry.
No, it's okay. So then it'd be 21.
Perfect.
Okay. And then starting to do adduction, which you have to flip over.
If she
Or it would
flipped
just
over, will it
straight-
change?
Oh yeah, that's right.
No.
So then, figure 8. Okay, and that's even. Okay, so adduction. So then it would be 21 as well,
Where did you start?
at 0.
Okay. And then which direction did you go?
Oh, down this way.
So it would be 21 or 19.
Oh, okay, 19.
19.
Yeah,
There you go.
because I didn't go out this way.
Right.
Okay, that makes sense. So basically, you're lining up the axis with the
Yes.
Yes.
So
Yeah.
the axis is going to be the ASIS.
Mm-hmm.
The stationary arm is going to be parallel with the other ASIS.
Okay, so physically check for it to
Exactly.
make sure that it's
Yes.
aligned. Okay,
Yes.
and then it will be pointing towards the patella.
Right.
Okay, so this is the black line, correct?
Yes.
Like just a imaginary line.
Right.
Okay.
Perfect. So then what other motions do you have at the hip? So we have flexion, extension, abduction, adduction. What else?
Internal rotation and external rotation.
Internal, external rotation. How are we going to measure this?
She's gonna be sitting up.
Okay.
Yeah.
Sorry, what's your name? Adam. Adam. Perfect. All right. You want to get in this mix? Sure. All right.
We all have the same class.
Are you guys first class, second class?
We're the second class.
Second class?
Mhm.
Okay. Have a seat, Renee.
Okay.
Okay, so if we're doing internal, external rotation, right? This is the same thing as with the shoulder. Your stationary arm